And that's really the core of the REDI intervention that we studied, was an attempt to build up emotion regulation, social connection skills, and problem-solving skills to facilitate resilience for children in growing up in contexts of adversity, and foster their capacity to have better coping skills as they move forward into school.
That's Dr. Karen Bierman, who will talk about her article on the adolescent mental health outcomes of children who received an enriched learning and reading program in preschool. Her work appears in the April 2021 issue of the American Journal of Psychiatry. I'm Michael Roy, Executive Editor of the American Journal of Psychiatry, and this is AJP Audio. Dr. Karen Bierman is the Evan Pugh University Professor, Professor of Psychology, Professor of Human Development and Family Studies, and Director of the Child Study Center at Penn State University. Her research looks at the design and evaluation of programs for social and emotional learning within schools and within communities. She has also developed and evaluated group interventions for peer-rejected children. Dr. Bierman is the lead author of an article in our April issue entitled Reducing Adolescent Psychopathology in Socioeconomically Disadvantaged Children with a Preschool Intervention, a randomized controlled trial. Dr. Bierman, hello, and welcome to the podcast.
Hi, thanks so much for having me.
Now, throughout your career, you have studied programs aimed at promoting social and emotional well-being in children at school and in the home. Before we get into the details of your article in the journal, could you tell us how you became interested in this area of research?
Sure. After I finished college, I actually got a job working in community mental health. And my job was providing services to a caseload of older adults who had very long-term chronic mental health illnesses. I enjoyed the work very much, but getting to know these individuals, one couldn't really help not feeling somewhat sad about the lost potential. It became very clear that the mental health challenges they had really kept them from doing things in their lives that they would have been able to do otherwise. And I think that's what really got me interested in and passionate about this idea of, getting to vulnerable children and families sooner and looking at prevention programs that could build coping skills and maybe reduce or offset completely some of these kinds of later mental health challenges.
Well, thank you for sharing some of your background with us. Now, as you point out in your article, previous work has revealed that adversities in early life can have negative effects on later development. This can include how well a person is able to regulate stress and emotions. What do we know about how exposure to chronic or unpredictable negative circumstances disturbs the developing brain?
That's such an interesting area of research, and it's really, really grown a lot over the last 15 years or so. I think we understand much more about the processes by which chronic stress, adversity, growing up in situations like poverty, how those sort of get under the skin and really affect the developing brain. So one of the things that we know about the preschool years is they are a period of time when the prefrontal cortex, that part of the brain, grows very rapidly. It's very affected by the context that children find themselves in. So you can imagine if you're in a situation where you're living in a sort of safe and secure environment, you've got responsive, caregiving adults, you've got a predictable routine, that provides a context in which the brain can more easily learn to predict, plan, problem solve around the kinds of social emotional challenges that young children face. But if you're growing up in an environment that is more unpredictable, that is more threatening, perhaps with caregivers that are either distracted by stressors that are affecting their life or by life context, like work schedules that don't match well with a young child's availability for interaction. These kinds of things, these sort of chronic stressors and unpredictability they really end up sort of prioritizing responses that are more impulsive, that are more reactive to the environment, that are more geared towards sort of instant survival or gratification. There's not a lot of value in long-term prediction and planning if you're living in a context that doesn't really support that kind of activity. And so what we see very often in children who are exposed to chronic stressors and adversity is that the self-regulation systems that really depend on that prefrontal cortex, the planning, the impulse control, the attention to longer-term rewards and benefits of self-regulated functioning, these don't develop as quickly. They're not living in an environment that privileges or prioritizes that development. And that has real consequences for them as they move into later life, into the school years where lots of self-regulation is required, lots of delay of gratification, and it has real consequences later in life in adolescence and in adulthood and workplace behaviors, relationships. So very, very important research on understanding, well, what happens to children growing up in more adverse contexts.
Well, building off this concept of unpredictability and adversity in terms of background, your article focuses on an intervention developed to enrich preschool classrooms, specifically with children from low-income backgrounds. Could you give us an overview of why this intersection of growing up in adverse conditions and the beginning of formal schooling is significant in the life of a child?
So we really targeted the preschool years because that's when so much growth is occurring in the prefrontal cortex and in these the capacity for self-regulation, for managing your emotions, for beginning to stop yourself and plan and problem solve, organize yourself around longer-term goals. Even though we understood that many of these children were living in very challenging home situations because of the exposure to chronic poverty, at the same time, we felt that preschool offers an opportunity to provide a predictable context where coping skills could be taught. And that's really the core of the REDI intervention that we studied, was an attempt to build up emotion regulation, social connection skills, and problem-solving skills to facilitate resilience for children in growing up in contexts of adversity and foster their capacity to have better coping skills as they move forward into school.
So now that we have some context for your work, let's get to the objective of your study. What were you hoping to achieve in your work?
So our intervention really involved trying to enrich existing Head Starts. That Head Starts, as many of your readers probably know, are a federally and state-funded organization focused on providing high-quality preschool to children growing up in low-income families. And our goal was really to enrich the programming that was going on in very specific ways, driven by this developmental research, focusing on social emotional skills and focusing also on language skills, because we also know from developmental research, they play a fundamental role in being able to interact well with other children, being able to understand and follow rules at school, being able to plan and problem solve. So the social emotional skills, the language skills, really, our goal was to develop a curriculum-based program that allowed teachers to really focus pretty intensely on building those skills, with the hope that we would then see children more prepared as they moved on into school to form positive relationships with peers and teachers, to connect with interest to school activities, to be able to sustain their attention, and then thereby do better in school, with the long-term hope that that brings them a higher quality of life down the road.
And you referenced the REDI intervention already. The focus of your study was on adolescent outcomes produced by the Head Start REDI program. Can you summarize what this program involves?
So the context for the program was we were working in the context of Head Start, really a very well-developed, well-regulated system of delivery of providing high-quality preschool to children. But Head Start, like many early childhood programs, the main curriculum that were being used, in this case, high scope creative curriculum, these were programs that were developed 40, 50 years ago, and they have a lot of strength in terms of providing a framework for preschool education, but they're not really infused with what we now know are these really critical social emotional survival skills, and they're really not focused either on specifically and intensively supporting language. So we worked in that context, and we brought in curriculum based intensive modules that teachers then taught. That REDI took on average about 2.5 to 3 hours of the day, where teachers were in the social emotional curriculum we used, which was the preschool paths curriculum. Teachers are doing lessons on feelings, they're doing lessons on friendship, they're doing lessons on self-control, the turtle technique, and on problem solving. And then in our interactive reading program, teachers are reading books that were selected to touch on the same theme. So they're organized along a sequence and a process. And then we also had letter learning activities and phonological awareness activities to enhance reading readiness. So the goal was really to take a pretty good preschool program, but now enrich it with these very targeted areas that we anticipated would have long-term payoff for social emotional well-being.
Okay, so that's the program. Could you tell us about the participants of the study?
So in Pennsylvania, Head Start is organized at the county level. So we worked with 3 different counties in Pennsylvania, altogether 25 Head Start centers and 44 classrooms within those centers. The way we developed the randomized controlled design was that across those 3 counties, the different centers were randomized to either start the program in the very first year we were working in partnership, the second year we were in partnership, or the third year. So in that first year, we had some classrooms that were starting the programs that were randomly assigned to start in year 1. The other ones were control classrooms. So it allowed us to really compare the experiences of children going to Head Start being delivered under usual circumstances with children going to Head Start where they're doing the usual plus the REDI enrichment. So the participants varied a bit based on the county population. One of our counties was very rural. One of our counties was in a more urban center in the southeast part of the state of Pennsylvania. And another one was sort of mixed. It had a metropolitan area that's considered average in size with more suburban areas around it. The population was mixed in terms of ethnicity. Mostly we had white kids, Black kids, and Latinx children. Mostly Puerto Rican was their ethnic history. And that's the group that we worked with and then followed over time.
Great. And a few of the strengths of your study are that you reported on outcomes of the intervention 8 to 10 years after implementation, and also that you had relatively high retention of participants. How did you and your co-authors go about collecting and analyzing the data?
So I'm going to shout out to NICHD, which was our main funder for the entire course of this study. When we were first funded, we were funded to do the intervention and do a short-term follow-up period through first grade. So we connected with families in these Head Start programs to get informed consent. And the families really that was who we connected with over time longitudinally. So we looked at initial outcomes at the end of the preschool period. We then followed children as they moved into kindergarten, followed them into first grade. And then as we got refunded, we continued to do annual and then biannual assessments. So we really had very stable connections with these families over time. And I think that was the key in being able to keep so many of them over the 8 to 10 year period until children were in 7th grade and 9th grade, which was the period that we studied in this article.
Well, let's get to the article. I'd like to turn now to the results of your work. How well did the intervention work in terms of reducing conduct problems, emotional symptoms, and peer problems among the students?
So we really looked at that in 2 ways. First, I will mention that in this period, that most children in 7th grade were in middle school, most children in 9th grade were in high schools, and the intervention used ratings collected from their teachers. So the teachers who were involved knew from the information we sent them that we were following up children who had been in Head Start, and we were doing a study to understand how well they were adjusting to middle school or high school. The teachers did not know that some children had received REDI while they were in Head Start and others had been to usual practice Head Start. And so in that sense, they were really completely blind to condition. We chose the teachers because we felt that teachers have an opportunity to see how children are doing in that school context, which was one of our main goals of the REDI project, was improved school adjustment. And they also have the ability to see children relative to other children at the same age. And so they tend to give ratings that are pretty well normed. They have a good sense of what good adjustment and what problem adjustment looks like. In our study, we use the Strengths and Difficulties Questionnaire as our main measure, which has been very widely used as a screening measure of mental health adjustment. And we looked both at the ratings that teachers gave children, and then we also looked at the proportion of children who ended up with ratings that would, in the screening measure of the SDQ, indicate a need for referral for mental health services. So what we found on the continuous measure was we found significantly better adjustment for students who had experienced REDI in their Head Start year in the area of reduced conduct problems and reduced emotional symptoms. That was very exciting to see that the intervention had an effect on both reducing these externalizing difficulties and also internalizing difficulties. When we looked at rates of that proportion of children who would qualify as having clinically significant referral levels of problems, we found that the same effect was there for both conduct problems and emotional symptoms. Fewer children, REDI moved fewer children out of that high risk domain. And we also saw an additional effect in the area of peer problems. So children who experienced REDI way back in preschool, now we're hitting these adolescent years, and we're finding it easier to get along with their peers in school as well.
That all is quite something. What were other key findings that you and your team documented?
So something very interesting, I think, because we had been tracking these children over time, was some of the shift that occurred as children moved into adolescence. So in the early years, we saw, in fact, through elementary school, we saw effects that were primarily kind of the direct outcomes of the skills that we were working on in the preschool program. So our main effects through the elementary years were in the area of enhanced social competence, enhanced learning engagement, so their attention and their focus on schoolwork was better. It was kind of the direct picture of the social emotional skills that we had focused on in the preschool paths and the language interaction. It wasn't really until after children transitioned into adolescence that we begin to see the impact of those enhanced skills on now reducing mental health difficulties. So that was a very interesting and an exciting transformation, really, that it wasn't just that there was a promotion of early skills, but that, in fact, as theory would have us hope it would work this way, that also reduced then their risk for later mental health difficulties.
And did any of the results surprise you or stand out to you?
I think we were excited to see the results because the intervention, it was different than many other studies that had been done before. We have long-term studies of preschool programs, but those typically are comparing children who went to preschool with children who didn't, who stayed in some kind of home or babysitting care. And so that literature has been important in motivating across the country and a greater public investment in preschool education. We've seen a real rise in not just the federal funded Head Start, but many more states are funding pre-kindergarten programs. But our study was different in that sense because all of the kids, intervention and control group, were attending Head Start. It was a more focused study on can we tweak, can we enrich, can we kind of use our developmental research to to modify some of the content of what's happening during that preschool day in ways that has more payoff, and in our case, especially payoff in the mental health area for children who are vulnerable because of their early circumstances. And so, of course, we hoped that we would see these long-term effects, but it's really exciting that they're emerging with the level of effect size and significance that they have.
Now, as we've been discussing, the long-term and the control condition, I mean, the study is very well designed, but are there any limitations to your study that may have affected what you and your co-authors found?
So there are a couple. So one limitation is this study was based on teacher ratings, and we're interested. In fact, we have continued to follow the children. NICHD has continued to fund us. We'll have the opportunity to follow them actually into early adulthood. And we are including more interviews with the youth themselves, looking also at parent ratings. So we're interested in seeing beyond the teachers, how widespread are the positive effects. The longitudinal significance of this is something that's going to be really important to understand. So we see this in early adolescence. This paper really focused on, does that continue to pay off as children move forward? I think another important limitation is all of our Head Starts. We were in 3 different counties that were very varied demographically in Pennsylvania, but they were all in Pennsylvania. And I think it would be very important to understand what's the generalizability of the findings to other populations. We were focused on children from low-income families. Would the same kind of program have also had benefits if we'd had a broader socioeconomic range in the sample? We didn't have enough to really understand were effects similar for children from different race, ethnic backgrounds, or children coming from Spanish-speaking homes. So there are a number of questions that just have to do with the generalizability of the findings.
Okay, now I'd like you to take a step back and give a higher level view. We've mentioned earlier that growing up in poverty amplifies the risk for contact with chronic stress and adverse experiences, but that appropriate interventions may lower this risk. So how does your work fit into the overall literature on this subject?
So one of the things that has been important in the literature that I had just mentioned is that most of our literature on the benefits of early intervention, and especially the benefits of preschool intervention, have been preschool versus no preschool, have been just that focus of getting children into preschools. And another limitation of existing research, this sort of links back to about 20 years ago or so when we were in the No Child Left Behind, and schools really started collecting data on how children were doing when they first entered school. And one of the things that became very apparent and very distressing really was the large disparities that were evident as children were entering kindergarten in terms of readiness skills, things like the development of their language skills, the development of their emergent reading and math skills, as well as the social emotional skills we've focused on, the self-regulation and social skills. And in the No Child Left Behind era, the thing that grabbed schools' attention, and I think much of the research attention, was, well, can we address the academic skill disparities? Can we use preschools more effectively to reduce that gap? And there's no question that's an important area of study. But what got left behind, I think, was how can we address the gap in social emotional readiness and in these resilience and coping skills that are going to be so important, not just for later school, but for later life. And so I think the other important thing about our study was not only was it looking at the question of, can we do better with the preschool delivery structures we're already paying for? Can we, tweak what's happening in the programming in those places to get more for our investment and more for the children? And the other part is really trying to understand what is the long-term benefit of balancing the academic focus with a more intensive social emotional learning focus.
So in essence, no aspect of a child's life left behind either.
Yeah.
And as we begin to wrap up, I'd like for us to look ahead here. What are some of the implications that your work has, particularly for public health policy?
So I think it really reinforces a couple of initiatives that are underway nationally. One is the value of looking at preschool education as a period of time where we can make a real difference in children's lives, that is a real critical window. And I think the other is there has been an increasing national interest in social emotional learning and in schools taking that every student succeed, the broader view of the way that they can support long-term development. I think in these pandemic times, that's probably even more of a concern of schools and of parents, the community at large. And so I think these are areas that are already getting some movement in public policy, and this study reinforces the value of those. I think in the early childhood education area, there's currently, I would say, a healthy debate about how do we use that time period most effectively to benefit children. And I think this study hopefully will also encourage future researchers to look at these programming issues, this is the quality of how time is being used during the day and what resources teachers are being given to support skill development in the children that they're working with.
Okay, so here's your chance to drive home the takeaway message for our audience here. Overall, what are the key points that researchers, clinicians, and other mental health professionals should take away from your article?
I would say, let's get ahead of the risk. Let's get ahead with these promotion kinds of programs where we identify, essentially has identified skills that are used in therapy to enhance emotional functioning and social relationships and translated them into skills that can be taught in a classroom setting. We're working now in a similar program that helps parents teach these same skills. But we want to expand the mental health field to not think of ourselves only as the treatment once individuals are experiencing significant disorder, but also trying to get ahead, use the kind of knowledge and techniques that we have at that back end, pushing it into the front end to really build skills that will enhance well-being among youth and then our later population.
And finally, as part of getting ahead, what are some of the recommendations you have for further research in this area?
So probably the biggest challenge in trying to scale up programs like REDI is that REDI was a pretty intensive program, and it required Head Start teachers administration to really put a lot of emphasis on this area. I think what would be terrific for us to better understand in research is the critical elements. What's the level of intensity that's needed for this kind of a program? How much can be done through professional development efforts to just educate teachers about providing them with ideas and supports, and how much relies really on the material resources, the kind of curriculum components that we use. These are the kinds of things that are going to affect the scale up, the capacity to move beyond model programs into broader diffusion efforts. And in my mind, that's probably the most critical direction for research to move, is replicating this kind of study in more populations, but then also really understanding what drives it and how we can use the understanding of critical mechanisms to maybe simplify or clarify what needs to happen in scaled up diffusion.
Dr. Karen Bierman, author of an article in our April issue on the use of an enrichment program in preschool to reduce symptoms of psychopathology at the transition from middle school to secondary school. Thank you so much for speaking with us.
You're welcome. Thanks for having me.
This concludes this episode of AJP Audio. You can rate and review the podcast on iTunes, Stitcher, or wherever you listen to it. Please also visit our website, ajp.psychiatryonline.org, to check out trending articles, find CME courses, and watch videos highlighting some of our other articles. APA Publishing has other podcasts you can listen to. Psychiatry Unbound is the books podcast from APA Publishing. It's hosted by Dr. Laura Roberts, editor-in-chief of APA Books. Also check out From Pages to Practice, which reviews the latest research published in the journal Psychiatric Services. It's hosted by Dr. Lisa Dixon, editor-in-chief of the journal, along with Dr. Josh Beresin. You can subscribe to these podcasts on Apple, Google, Spotify, or on any of the popular platforms.
Next month on AJP Audio, we'll talk with Dr. Laura Coughlin of the University of Michigan about her work on the quality of outpatient depression treatment in patients with comorbid substance use disorder. We hope you'll join us too. Thank you for listening.